Welcome to DermWire News, powered by DermWire.com. DermWire News for Smart Speaker is made possible with advertising support from Ortho Dermatologics.
Jeuveau gets the FDA nod, AMA addresses the impact of prior authorizations, and the dermatology community remembers Dr. Vic Narukar. Ahead on DermWire TV. Welcome to DermWire TV from the editors of Practical Dermatology magazine. I'm your host, Rana Jaraha. The FDA has approved Jeuveau, the lead product from Evolus, and it is expected to be available this spring. Jeuveau is cleared for the temporary improvement in the appearance of moderate to severe glabellar lines associated with corrugator and/or procerus muscle activity in adults. With the approval, Evolus becomes the first company in nearly a decade to enter the U.S. aesthetic neurotoxin market. Jeuveau is the first FDA-approved neurotoxin dedicated to aesthetics. Dr. Ava Shamban, a clinical investigator for Jeuveau, says, "The outcomes I've seen for my clinical trial patients firsthand, combined with a comprehensive clinical data set for Jeuveau, provide a compelling new treatment option for physicians and their aesthetic patients. The Transparency program involved more than 2,100 patients globally, including a head-to-head trial versus Botox, in which all the primary and secondary endpoints were met. There were no serious drug-related adverse events reported." David Motazetti, president and CEO of Evolus, spoke to DermWire TV about the differentiation of Jeuveau.
This product in particular presents a unique opportunity for doctors. It's the first 900 kilodalton molecule, so scientifically it carries the same molecule as the market leader. And we're very differentiated in that not only are we aesthetic only, but we've conducted the largest Phase 3 head-to-head trials in Europe comparing Jeuveau directly to the market leader, so that when we introduce Jeuveau to the market, doctors can see a comprehensive data set that'll support the efficacy and safety of Jeuveau.
Michael Jafar, Chief Marketing Officer at Evolus, commented on market potential for the new product.
Any consumer and any customer always likes to have an option in any market that you operate in. And they've been rather limited in the medical aesthetic space, and we now have a great option. Our role in this premium brand is to expand the market. There are nearly 2 million consumers between the age of 30 and 39 that have all expressed interest in entering the space within 12 months. And the mindset in which we're targeting is a millennial mindset. It's a fresh, kind of a younger mindset that can influence up to the broader generations, such as Generation X and Generation Boomers. But the communication style, the feel of the brand will be lighthearted, it'll be approachable, it'll be fun, and that aspect to the market will expand this market. We'll simply make the experience of beauty delightful.
Evolus anticipates publication of U.S. Phase 3 results in the near future. 28% of physicians say the prior authorization process required by health insurers for certain drugs, tests, and treatments has led to serious or life-threatening events for patients, according to results of the survey released by the American Medical Association. The survey of 1,000 practicing physicians found that prior authorization continues to have a distressing impact on both patients and physician practices. Dermatologist Dr. Jack Resnick Jr. is AMA chair. He said in a statement, "The time is now for insurance companies to work with physicians, not against us, to improve and streamline the prior authorization process." The AMA survey revealed that 91% of physicians say that prior authorizations programs have a negative impact on patient clinical outcomes, and 65% report waiting at least one business day for prior authorization decisions from insurers. More than 9 in 10 physicians say that the prior authorization process delays patients' access to necessary care. 75% of physicians report that prior authorization can at least sometimes lead to patients abandoning a recommended course of treatment. Every week, a medical practice completes an average of 31 prior authorization requirements per physician, equivalent to nearly 2 business days of physician and staff time to complete. Practical Dermatology will address issues related to prior authorizations this spring. The December issue, available online, addressed related factors that influence drug costs and patient access. The dermatology and aesthetics community is mourning the death of Dr. Vic Narukar. A well-known researcher, author, and lecturer, Dr. Narukar was a past president of the American Society of Cosmetic Dermatology and Aesthetic Surgery. He was a co-director of the Cosmetic Boot Camp. He founded the Bay Area Laser Institute in San Francisco. Colleagues Dr. Janine Downey and Dr. Heidi Woldorf spoke with DermWire TV about Dr. Narukar.
Not just in my opinion, but in many people's opinions, the dermatology community has lost one of its giants. He was one of my heroes, and he made me a better doctor. Vic held himself to a very high standard, and he held industry, pharmacy, device companies, his friends, his family, his patients, his staff, to very high standards. So I'm going to try to live up to Dr. Vic Narukar's high standards.
Vic loved practicing cosmetic dermatology. He loved the science of it and his patients and his colleagues. My memory of Vic will always be of our first meeting when I was interviewing for fellowship at Cleveland Clinic, and he was a second-year fellow. At the time, unbeknownst to me, he was 5 years younger than I was because he had started medical school, actually college, as a mere child. When talking to Vic about any issue, whether it was rabble-rousers, haters, difficult people, or difficult situations, Vic would smile and with a wave of his hand basically brush it away and say, "You do what's best for you and what you think is right."
Dr. Narukar was a member of the editorial board of Practical Dermatology magazine. We send condolences to his family and friends. That's it for this edition of DermWire TV. If you don't get dermatology news updates on your Echo device, visit the Amazon Skills Store and enable the Dermatology News skill. Then tell Alexa to play Dermatology News. You can also get news updates anytime at DermWire.com. Thank you for watching.
Thank you for listening to DermWire News. This editorially independent program is made possible with advertising from Ortho Dermatologics.